Obesity in older adults presents far more than a cosmetic concern. It significantly undermines physical function, personal independence, and quality of life. As the body ages, maintaining mobility becomes increasingly dependent on preserving strength, balance, joint integrity, and cardiovascular efficiency. Obesity adds stress to every one of these systems, accelerating physical decline and making everyday activities, walking, climbing stairs, rising from a chair, more challenging and hazardous. The weight itself becomes a burden, but even more importantly, the metabolic and mechanical complications that come with it amplify the risks of frailty, injury, and long-term loss of autonomy. One of the clearest impacts of obesity on older adults is reduced musculoskeletal efficiency. Excess weight places continuous pressure on load-bearing joints such as the knees, hips, and lower back. Over time, this contributes to cartilage degradation, joint instability, and painful conditions like osteoarthritis, which in turn discourage physical activity. This leads to a vicious cycle. As pain increases and mobility decreases, movement becomes harder, weight gain worsens, and independence declines further. The ability to perform instrumental activities of daily living, cooking, shopping, managing medications, or even walking to the bathroom without assistance gradually erodes. Muscle quality also deteriorates in the presence of obesity, especially in aging bodies already prone to sarcopenia, the natural loss of muscle mass and strength with age. In many obese seniors, fat infiltrates muscle tissue, reducing its power output and impairing coordination. This leads to slower walking speed, difficulty rising from a seated position, and an increased likelihood of using mobility aids such as walkers or canes. Balance is also compromised as the center of gravity shifts and the body's postural control systems are overburdened, leading to a substantially increased risk of falls. Falls in elderly populations are a major cause of hospitalization, fracture, and mortality, and obesity amplifies both the risk and the severity of these incidents. Beyond the mechanical consequences, obesity impairs cardiovascular and respiratory function, which reduces endurance. Older adults with obesity often become short of breath with modest exertion, limiting their ability to walk even short distances without rest. This discourages participation in social or physical activities, contributing to isolation, depression, and further functional decline. Fatigue becomes a persistent issue, often mistaken for simply getting older, when in fact it reflects systemic overload and poor metabolic efficiency. Importantly, the loss of mobility driven by obesity does not only impact the body, it diminishes identity and self-determination. Seniors may become unable to travel, visit loved ones, attend events, or maintain hobbies that once gave them purpose. Relying on others for help with dressing, bathing, or toileting can be emotionally devastating and contributes to a growing sense of helplessness. Studies show that obese older adults are significantly more likely to enter long-term care facilities earlier than their normal weight peers, not necessarily because of disease, but because they can no longer function safely on their own. Yet despite these risks, the trajectory is not irreversible. Modest weight loss in older adults, particularly if it is focused on improving function rather than achieving cosmetic goals, can meaningfully restore mobility and preserve independence. Even a 5 to 10% reduction in body weight, when combined with strength training and a high-protein diet, can improve joint pain, increase walking speed, and enhance muscle function. Resistance exercises are especially powerful, as they not only preserve muscle mass but also improve balance and confidence in movement. These changes reduce fall risk and can allow older adults to regain a degree of freedom in their daily lives. Tailoring interventions to support gradual, sustainable change is crucial. Rapid or extreme calorie restriction can lead to further muscle loss and weakness, which is counterproductive in older populations. Instead, targeted approaches that prioritize nutrient density, physical rehabilitation, and regular movement, whether through walking, water aerobics, chair yoga, or home-based strength routines, can lead to substantial quality of life improvements without compromising health. Behavioral support, family involvement, and addressing psychological barriers such as fear of falling or loss of motivation also play key roles in maintaining engagement and progress. In conclusion, obesity in seniors is not just a number on the scale, it's a major determinant of whether an individual can live independently or will become reliant on others for basic needs. The excess weight strains joints, weakens muscles, reduces stamina, and raises the risk of falls and injury. But with careful, individualized attention, these outcomes can be delayed or even reversed. Small improvements in weight and strength can translate into large gains in freedom, dignity, and emotional well-being. Addressing obesity in older adults is not about chasing thinness. It's about protecting mobility, autonomy, and the ability to live life on one's own terms.